Hello there, what's your name?
Trudy.
Hi, Trudy, how are you?
Great.
You look nice and relaxed. And now, what are we going to do with Trudy?
Well, the next body part we're looking at is the face. And as you know, you go down the red carpet, you see people, and their faces are pristine, flawless, no wrinkles, no blemishes, nothing.
Yeah.
How do celebrities get an airbrushed look to their face when it's not on a magazine cover? Well, one of the answers is by doing laser treatments. And frequent laser treatments can really help to create that
We've
smooth
talked about
effect.
this before. It's painless.
Exactly, and that's what this is.
And you really believe that this super works. You see the results every day.
Yep. Now, this is the Cynosure Elite MPX. This is one of the newest lasers on the market. And one of the things I like about it is it has what we call the laser facial. And that's a non-invasive, no downtime, no pain, no nothing laser that we can do to literally tighten up all the skin in the face. It tightens up the skin. It helps to improve sun damage, closes up pores, and just some really nice results.
Wow.
So we're going to demonstrate that today.
Now, what does this cost?
This costs, depending where you have it done, anywhere from $150 to $200 a treatment.
And how many treatments would you need to see a noticeable difference?
We usually recommend a treatment every 3 to 4 weeks until the patients are happy with what they see. Most patients will purchase a set of maybe 5 treatments or so, and usually get a real nice result.
So it's a lot cheaper than having surgery.
Yeah, now this is not surgery. Once again, you do this during a lunch hour, go back to work afterwards, and nobody would have any idea. And also helps with the redness of the face, too.
That's great. And we have a little set of goggles
so now it's very important. Everybody put your goggles on. And I'm going to have you put these on over your eyes. Now, the goggles are real important because these are real lasers, okay? And I know it feels like you're in high school shop class right now, probably.
No, I was doing the Elvis, really.
All right, so this is a laser. You can see that red dot. And basically what we're doing is we're just zapping her skin.
Trudy, does that hurt at all?
I don't feel anything.
You feel anything at all? No. And what it does is it creates some deep heating of the skin. And that deep heating will tighten up the collagen to gradually tighten up the skin over time. Now, once again, it's not just one treatment. You do need to do multiple treatments to get your overall effect. Do you feel anything with it, or is it just pretty mild?
Very mild.
Yeah, do you feel any heat at all? Sometimes people say it feels a little bit like they're under a heat lamp.
No.
Great.
That's fantastic.
Now,
I mean, it doesn't hurt or anything. That's great.
Now, we've probably only done just a handful of treatments on her. I want you to try it on myself here. I'm going to turn this baby on a little bit higher. I'm going to have you take it out, put it in your hands.
Yeah.
And I want you to go ahead, and you can see, I want you to aim that beam. You can see that red beam right at that mole here. And let me go ahead. I'm going to press a button, okay? Ah!
Ah!
Oh, I'm just kidding. That's
oh, you... Really?
But you can see it's real mild.
Stick to being a doctor, prankster.
I'm treating my skin, and you can see it's real mild. You can't even hardly tell.
Here, try mine now.
And you can't really even hardly feel it.
Oh, my God, you can't feel it.
So it's real mild.
We have a before and after of this, right?
We do, so let's take a peek. And you can see
fantastic.
Pores are smaller, the skin looks tighter. It's just a really nice treatment.
The skin looks noticeably dewier and younger. The pores are much smaller.
Exactly, and there aren't a lot of treatments out there that you can do and just go back to work and see a visible change when all is said and done.
You're going to give Trudy the rest of her treatment when we go to break, right?
Yep, yeah. And we can take our glasses off now, too.
Cool. Thanks, Trudy.
All right,
let's move over.
Well, what is the...
Hello, what's your name, lovely?
Christina.
Hi, Christina. Really cute shirt, Christina. So what are we going to do with Christina?
Well, what is the one thing that can ruin a $100,000 dress, thousands of dollars worth of jewelry, and a great hairstyle? Sweat stains in the armpits.
Oh, yeah.
So now the good thing about the laser that we just looked at is that can do laser hair removal to an armpit and create those smooth, silky smooth armpits that you see on the red carpet.
Yeah, yeah.
But what's the other thing we can do? Well, we can actually ditch the antiperspirant and use Botox instead.
Is that safe?
Botox is FDA approved to treat excessive sweating of the armpits, and it really works, and usually lasts for a good 6 months, sometimes more.
6 months?
Yeah,
so 6 months, you simply will not sweat under your arms.
Exactly, and it really does work. It's amazing.
All right. Here's a nitpicky question. If it ain't coming out of your armpits, where's it going? Do you have a river runs through it down your back or what?
No, what the Botox actually does is it interrupts the nerve impulses to the sweat glands of your armpits.
Gotcha.
I mean, you can sweat elsewhere, but it just is that localized phenomenon.
But does it cause you to sweat more elsewhere?
I've never heard of that before.
All right.
I don't think so.
I'm just asking all the questions that occur to me, that's all.
Now, in order to determine where to inject the Botox, we need to actually figure out where in the armpit to inject it. And there's actually a test. It's called the Starch Iodine test. We're going to perform that today on Christina. I'm going to have you lift your arm up behind your head. And what we can do actually is by doing this test, we can actually see via this crazy chemical reaction exactly where the sweat glands are in her armpit.
Really?
So the first thing I do is go ahead and, this is an iodine swab. We're going to swab her armpit And then we take some cornstarch. Like I said, plastic surgery, a lot like cooking. I took this out of your cupboard because I forgot to bring mine today, but you can use it again later if you want. And we go ahead and we brush your armpit.
Everybody's a comedian. MacGyver here.
So we go ahead and we brush your armpit, and you can see already...
Oh, so much for that cute shirt, sister.
You can see already her armpit's turning a little dark. And what happens in a good 10 or 15 minutes, the cornstarch with the iodine will actually create this crazy chemical reaction and turn her armpit black. And the black color is where you know that she has a sweat.
Wow.
So it's pretty cool. Now,
that is cool,
what we did, because we know we don't want to wait 10 or 15 minutes to see this to happen, I actually treated her other armpit about 15 minutes ago. And let's take a peek at that.
Whoa!
So you can
that matches your shirt.
So what
Man,
I'm going to do...
you're a good sport. Thanks for letting us look at your pits.
What I'm going to do is we're going to go ahead and outline where we're going to inject
now, how much does the Botox to do both arms come out to?
The Botox, it's about $1,000 because it's literally, it's one vial, full vial. The vial itself is pretty expensive. Okay, now, Christina's actually had it done before. And
were you happy with the results?
Oh, yeah. It worked really great.
Was it so fun to, like, not worry about having sweat stains on anything?
Oh, yes.
And what I'm doing is I drew a little circle around where we're going to inject, and we're going to take a little alcohol. We're kind of wiping it off.
So you've had this done before. Does it hurt?
Not really. Just little pinches.
Just a little pinch?
Yeah.
Now, how many injections would it take on each arm?
Probably about a dozen.
12 shots.
Yep.
Ooh.
Yeah, so we're going to use a good amount of Botox. I've actually got 2 different syringes today that we're going to go ahead and inject, and that's what I'm going to do right now.
Put your hand for you.
And we'll do it real quick. It's like when you take a Band-Aid off. You don't want to do it real slowly. You just take it off and get done with it.
Tell me when you're done. I can't look at needles going.
One more here. How's it feeling? You doing okay?
Yeah, I hardly feel it.
Good.
I'm squeezing her hand like I'm getting the shot, and she's like, I'm fine. Oh, I caught a little glimpse of that one.
That's it. Let me wipe one little spot of blood.
She had a little spout of blood, didn't she?
Just a tiny bit, but it's gone.
You're a tough cookie, my friend. Thank you, Dr. Youn. Good job, as always. Up next, snack of the day. Marshmallow crisp popcorn. Marshmallow crisp popcorn from Colonel Encore. Oh, very funny. Colonel Encore from Orlando, Florida. Thank you to our good friends in Florida. Snack of the day. Grab a snack. We'll be right back.